Hey guys, Mickey Brueckner here with Dr. Greg Spatz, and we're here with video 1 of the Baseball Performance Project, and today we're going to discuss principles of an early off-season training program and what that really looks like. We have a specific time and things that we're trying to do with athletes who are coming off of their long baseball season. So Greg's going to kind of bullet the list in terms of what we're looking for the first month out.
Yeah, so some of the focuses that we have in the early off-season, one is that we're having an assessment done. It's extremely important to get an assessment, no matter who the professional is. Number 2 is to restore general movement qualities. I'll sort of be focusing on these first 2 points in a little bit. And then number 3 here, building a baseline of movement and strength capacities. Number 4, avoid specificity. So this is where there's no baseball activities going on at this point of the year. And Mickey will be touching more on number 3 and 4 here. Based on the assessment, we're looking for different things that might be limited. Oftentimes with baseball, we're looking at the shoulder because it's just one of those joints that's often limited after the rigors of throwing for so many months in a row. Things add up, right? Other things we might specifically look for is asymmetries in rotational patterns, how the joints are moving individually and as a whole, right? Because baseball is such an asymmetrical movement pattern, it tends to come out in the wash at the end of the season that testing will show that. Based on the assessment, if there are different things that might come up as painful, definitely something to get looked at. Pain is not something you want to be working around or through all that much, so definitely have a healthcare provider take a look at it. If it's something that needs to be looked into a little bit more to just determine that there's no pathology, then obviously you want to take care of that right now. This is an important time to set that foundation. So here at the Annex, if an athlete comes in and their first point of contact is Mickey, who's doing their assessment, that's great. It's awesome because most people aren't coming in with pain or anatomy that's broken that they need to be seeing a healthcare provider first. So it's great where Mickey can take a look, see if there's any gross asymmetries or different restrictions in joints that he might feel like he needs a little bit of help with. If he does, I'm right next door. He kicks him over and we look specifically at what types of drills or stretches that might need to be implemented to get the joints moving the way they should, get the entire system to be a little bit more symmetrical, so that we can set that foundation up and they can just get right back to training with him, no questions asked. Sometimes I might be the first point of contact here at the Annex where a baseball player is coming off of an injury or something that did bug them during the season that potentially their team, their coach, or a doctor said you should probably have a physical therapist work with you. I might be their first point of contact. So that's where they're coming in. We're definitely going to address, first and foremost, what is going on with that injury or that pain, and what type of limitations that we can improve to help with that issue. Then right away, we always want people to progress right to training as soon as possible. So I'm going to be doing my best job to get them over to the training floor with Mickey and his staff as soon as possible, and potentially maybe avoiding certain movements just for a period that might need to be accommodated for their limitations. But right away, we're trying to get people as soon as possible get into training because there's always something you can do to set you up for a successful off-season and then future in the spring.
Okay, so Greg did an excellent job of discussing the first 2 points. Again, just to reiterate, assessment's super important. And then from there, we take all that information from our assessment, attack our lowest hanging fruit, and see what general movement qualities we need to start restoring. So once we've done that, once we've established where limitations might occur with each athlete, then we're going to start to build just general movement qualities and overall strength qualities as well. So what that really means is, Greg touched upon it, is we want to make sure kids can squat properly, they can hinge properly, push and pull in different planes, they can load their joints properly and make sure that they're rotating and there's no major underlying asymmetries with all that stuff. And then from there, we're just building capacities in a lot of those movement patterns and then just overall strength adaptations. When we look at the general approach in this given time of the year, we're really looking at more of the general aspect of training. So focusing on general patterns, focusing on general strength. If you look at this continuum here from general to specific, we're going to be spending a predominant amount of our time early in the off season in this side of the continuum, whereas this is kind of reserved towards as we get closer to the season. Okay. Another thing we could look at is something like the force velocity curve. We're spending more time in the lower velocity, higher force type movement patterns. We want to avoid like our higher velocity movements. So we're not doing as much sprinting here. We're certainly not throwing baseballs. We're not doing any of those things. A lot of our loaded implements are a little bit on the heavier side. Anytime we're throwing any med balls or implements like that, they're a little bit on the heavier side and less focus on velocity and rate of force production. That's more reserved towards as we start getting closer to throwing and ultimately towards the beginning of the season. So that being said, because of that, we want to avoid a lot of specificity. So we're really focusing on getting away from baseball activities. We're not throwing at this point. We're putting the baseball down. We're putting the bat down. We're doing anything that's generally just focusing on good quality patterns and not focusing on velocity. So those are kind of our biggest rocks that we're looking at in this first month to 6 weeks maybe. Everybody's going to be a little bit different dependent upon their assessment. Again, if they've got a lot of issues, then we've got to spend a little bit more time building a base. If not, then we don't have to spend as much time. We can spend maybe 2, 3, 4 weeks with some of these athletes. But again, the focus is the foundation we create within this first couple months is what we're building on in the later part of the off season and ultimately getting them into the season. That's our overall approach, and where Greg and I work together is if there's situations where I need his help, as he touched upon, if there's something that needs a little bit more medical attention or something more specific that's maybe not in my lane or something that I don't have the capacity to deal with, I'm more than happy to punt him or that given athlete over to them so that they can do their work and ultimately get them back to me as soon as possible. Thanks again, guys. We hope you got a lot out of this first video, our early off-season training protocol. Next, we're going to be breaking down the specifics of how we're transitioning kids out of an early off-season phase into their quote-unquote main off-season phase and then late off-season. And what we're going to be touching upon is how we're starting to transition other implements, how we're starting to transition kids into throwing, hitting, sprinting, and all those other types of things. And then the goal is to help get these kids and ramp them up into their in-season phase and ultimately into the season without any issues. So if you have any questions, please leave them, or comments, leave them below. And also, if you have any questions, feel free to email Greg and I, and we'd be happy to answer anything you guys have. Thanks again.